And okay, well, good afternoon, everyone. Thank you for coming. My name is Harold Schukel. I'm an outreach coordinator for Crossroads for Hope, formerly known as Kansas Sport Community Central New Jersey. In partnership with Elizabeth Public Library, we are happy to welcome you to Finding Mental Health Information You Can Trust. During today's presentation, we'll be discussing how your local library can help you access free, trusted mental health resources online and in your community, plus learn the basics of finding and verifying mental health information found on the web. Our presenters today are Ally Blumenfeld, Head of Information and Adult Services, as well as Nancy Berkenfeld, Librarian, Information and Outreach Services at Elizabeth Public Library. And just as I mentioned before, just be sure to mute yourselves. And the floor is yours, Ally. Feel free to take over.
Hi, everyone. Good afternoon. I'm so happy that you're here with us today. I am the Head of Information and Adult Services at Elizabeth Public Library, and I am also a Consumer Health Information Specialist, which was a training that I went through the National Network of Libraries of Medicine. And I'm joined by my colleague, Nancy. Nancy, do you want to introduce yourself?
Hi, I'm Nancy Berkenfeld. I am with the Information Services Department of the Elizabeth Public Library. I'm glad to be with you. And just like Ally, I too am also a Consumer Health Information Specialist certified by the National Library of Medicine. And I just want to welcome all of you and enjoy the presentation and hope that it will be worth, have a lot of information for you.
Yes, we do hope that you find this useful, whether you are a consumer of health information, which we all are, or whether you are representing an organization in which you serve clients that might benefit from this information. Nancy and I will share our contact information at the end if you have any questions or if there's any way that we can help you or provide any links or anything as we go on. So the purpose of today is just to talk about how we can find reliable health information online as it pertains to our mental health, and also go over some ways that the library has been trying to position itself as a conduit for this sort of information. So we partner with organizations in Elizabeth and Union County to help get our patrons mental health information and resources. And so we are connected with a few organizations, and we would love to connect with more so that we can provide this information. So when we talk about finding health information online, we know that it's a little daunting because there's just, where do you start? And a lot of us start our searches on Google or another search engine. And in our presentation, we'll go over some other websites that might be helpful to begin our search instead of just your average search engine. So if we do begin our search just, on the web, on Google or another search engine, and we have a list of results, some of those results are going to be advertisements, usually the first 3 or so. And once we get past that and we're clicking on a website that we think is going to provide us with information, especially about our mental health, there's some questions that we need to ask. So one of the first questions we should ask is who runs this site? Who pays for this site? And what we want to do when we're asking this question is try to find an about us or an about page. And typically, if that information is right at the top, readily available, that's a good sign. If you really have to dig for it, sometimes it's at the bottom, but in a clear location. But if you have to dig for it, or if you can't find it at all, that's not a good sign that this is a website that's trying to be upfront about who they are and why they're providing this information. On the About page, you will also see whether it's a nonprofit, a government website, or a for-profit website that's perhaps trying to sell you something, which is the next question. is this website trying to sell me something? So is the end goal of my use of this website to buy a product or to join an organization or to spend my money in some way? And now I don't necessarily mean to, there are websites like congregate websites that will find you information, for example, how to find a healthcare provider, a mental health provider. Of course, the end result of your time on that website is hopefully to connect with a therapist and pay them. So that's different. What I'm talking about is an actual product that's being peddled on this website, not the idea that the information you're getting will ultimately, end up in a transaction to a doctor. That's different. So where does the information come from? Is the information reviewed by experts? A lot of the time we're just Googling symptoms or the names of conditions that maybe were recently diagnosed, or maybe we recently started on medication. So most of the time we're Googling this information to find out more about the condition or the medication or the symptoms you're experiencing. So we're looking for, sometimes we come across articles, but just because it's written and published on a website doesn't mean it's legitimate or that the information is reliable and helpful to you. So we want to know who wrote it. Is there a byline? Does it say that it's written by a doctor? Can you look up that doctor and find that they're credentialed? Was it peer reviewed? Meaning, did somebody else in the field who's an expert also look at this article and vouch for it? Is the article up to date, or was the article published years ago? And sometimes for certain information, we do want the most up-to-date article that's being published or the most up-to-date information, because health information changes rapidly. Is the website asking for your personal information? Because it shouldn't. Unless it's asking, do you want to be on our newsletter mailing list and, put in your email address, that's okay. But if it's asking for personally identifying information, it's not the right website for you. The right website that's going to provide reliable mental health information will be one that does not need your data in that way. And lastly, are you reading news or advertising? A lot of the times when we search for health information, what comes up are actually news articles that may sensationalize a topic, or actually we're looking at websites that, again, are just selling you something. So we want to make sure the information is not slanted and it's trustworthy. So these are some of the questions to keep in your mind when you're looking for mental health information on the web. So if we want to go beyond Google, and that's just an example, there are many, people use many different search engines, but if we want to go beyond Google to begin our health information search somewhere that we can trust, that means if I'm searching for my condition or my diagnosis, my medication, or my symptoms, all the results that come up will be on this website. It's not going to take me to a website that might actually have paid to show up in the results. When we start our search on these trusted websites, the results that come up are also all going to be trusted. So we're going to take you through these three briefly, just to introduce you to these websites and what they can offer for you. And keep in mind that librarians, beyond books, we're here to just help you access all manner of information. So if you're ever using these websites and you need some help, hop over to the Elizabeth Library website, chat with us. You could call us, email us, and we can help you get the information you need. So Nancy, anything to add before I continue?
It would help if I unmuted myself. No, you're doing really great. So thank you. I couldn't have said it any better or more succinctly.
Okay, I don't know about succinct, but you probably could. But here we go. So we'll look at mentalhealth.gov. So this is one very simple resource that we can use to look up basic information about our mental health, whether we have a question or want to look up something that we're experiencing to get help, or to maybe get help for somebody that we know and love who would benefit from this information. So when we're looking at this website, keeping in mind the questions I asked before, when we want to know who's running this website, we could see one down here. It's being run by the U.S. Department of Health and Human Services. But here's the easily accessible About Us page. And here we can learn more about it. And so we can see that this is, being a .gov, it's definitely a trusted website, and we know that it's run by the Department of Health and Human Services of the United States. So hopefully we can trust now that the information that we'll receive on this website is trustworthy. So let's start with a basic search. So if I wanted to search for depression, I think, I or someone I know might be experiencing symptoms. Then I'm going to just do a basic search. Again, rather than start the search in Google, I'm going to start it on this website. All the results that show up here are links to pages on this website. So it's not taking me out of the website, it's not taking me anywhere else, but keeping me here. And you'll see that the first one is a link to an article that's just called depression. So this is just a basic overview, and you can see where it falls in all their other categories that you can search. So there's some related categories here, but this is probably the most basic resource we have, as this is basically just like a couple paragraphs of information, but we know that it's trustworthy. And there's other ways to search as well. We can use these tabs up here to sort of look through different disorders and the ones that are related. We can look at the basics of mental health, including what is mental health, myths and facts. These are different resources for different types of people. So you could see here people who are experiencing mental health challenges, young people looking for help, parents, friends and family members, and then of course how to get help. So there are links here to how to get immediate help, which brings you to hotlines that one can call, help for service members, help for how to actually use your health insurance and find a mental health professional in your community. So this is a very simple way that if somebody just wants to search for the basics, this is a good website to cover that. The website is also available in Spanish up here at the top right. If you click here, then the website will be translated into Spanish. Anything to add here, Nancy?
No, that's great.
Okay, great. So we'll move on. The next one is the National Institute of Mental Health. And that's this website here. So this one definitely looks a little bit different than mentalhealth.gov. This website provides a lot more information about a wide variety of topics, rather than that website, which is mostly just to get to the facts about different mental health conditions. I actually see that I'm on NIH, not NIMH, so I'm so sorry about that. Let me see if I can just navigate there, if there's a quick link or anything like that. Nancy, do you remember, is it NIMH.NIH? Or do you know what the exact link is? Here, okay, got it. Okay, so sorry about that. This is the actual National Institute of Mental Health, which is a subset of the National Institute of Health. But so this is a website that is just for mental health information. And again, you can conduct a search here. So we'll just run the same one so that you can see the differences. And this looks like a Google results page, but in fact, it is different, again, because all of these results are taking you to links of web pages that are in this website. So it's not taking you outside of the website. The first one here, we'll click on. And this gives us a lot more information than the last website. You'll have an overview, a bit of a much longer overview. You'll have signs and symptoms, risk factors, treatment and therapy, information on how to join a study, and then brochures and resources where you can learn more about different types of depression. Also, there are videos and multimedia links here at the bottom. So this is a website that is, it's a government website, it's trustworthy, and it's just a bit more in depth than the first one that we went through. So in addition to just doing a search up here, we can also browse health topics. So this is just a list we can use. We can also start our search with special populations. If you are a woman, older adult, or a man, or searching on behalf of a child or teenager, you can start your search here to see which mental health conditions might affect them. More specifically, brochures and fact sheets, how to get help, which is an important page. So these will be trustworthy helplines, hotlines, crisis call centers, and also how to find a healthcare provider down here. So this website is definitely has a lot more information to it. Anything to add, Nancy?
No, that's it. No.
Okay. And then of course you'll see there's always articles here on the front page to newest information, research as well. But if we're using this just to help somebody search on a topic that's important to them, then we'll just go right up here to search. And so the last one we're going to go over is MedlinePlus, and I think Nancy's going to actually screen share and walk us through MedlinePlus, which is probably both of our favorite one, and one because it's by the U.S. National Library of Medicine. So as a library, we just think this is a really great resource. So I'm going to stop sharing, and Nancy's going to share her screen. Looking good, Nancy. We can see your screens. Perfect. Oh, I think we can't hear you though. I think you may still be muted.
Okay. Can you hear me now?
Yes.
Okay, great. This is MedlinePlus, and as Ally pointed out, this is a very trustworthy website. If you scroll, let me get rid of this. I'm sorry, this is my personal computer at work, but it's not as reliable as my work computer. If you scroll all the way down, you will see that is published or produced by the U.S. National Library of Medicine. There's an address. It tells you that the National Library of Medicine is part of these departments. It has its webpage. It'll tell you the copyright, disclaimers, so you know that this is a bona fide website. This is not just dedicated to mental health information. It contains all different types of information on all health topics. So there's not even a subset. So you're going to have to do a subject search in the search box for mental health. But before I do that, before we go into a deep dive of mental health sources, I just want to give you an overview of the power of this website. If you notice here at the top, it has health topics. If you just want to browse just general health topics and you don't know really what you want, if you're just looking for something on maybe digestive issues or cardiac, this is where you would go. Drugs and supplements, you can click on the tab at the top or here at the side, and it has information on drugs and all sorts of vitamins and supplements. And it's also prescription drugs as well as over-the-counter drugs. And this is really good if you're being prescribed like an antidepressant or an antipsychotic, and you really want to get detailed information as to what is this drug all about, what is its side effects, how do I store it, what happens if I miss a dose, and what foods I can't eat with it. Drugs and supplements is your go-to place. if you're just given a medical test and you don't know what this medical test is all about, let's say you have a child with autism, which is part of the mental health umbrella, and you don't know what an autism spectrum test is, this will explain it to you. Medical encyclopedia, if you don't want any in-depth information, you want just the real general surface information, what is this condition, then you can click on the medical encyclopedia. If you're looking for healthy recipes, this is the place to go. Also, the National Institute of Health and medlineplus, they produce their own health magazine. So if you want to subscribe to it, has no advertisements. They don't ask you for your personal information. All they do is ask you for your email address so that they can send you the most updated issues when it is produced. If you need to know about clinical trials, this is another place to go to. Down here, if you're looking for organizations related to mental health, and you don't want to do a specific search, you can just click on M for mental health, and you can see National Association of School Psychologists, but you're not, so you can see all different types of medical associations by name. If you're working with someone who speaks a language other than English, these are the types of these are the languages that are covered in Medline. Not all languages are covered, and not all topics are covered in each of these languages. So for example, if you're working with somebody who's Korean and they're looking for information on Alzheimer's, which is also part of the umbrella of mental illness, you can click on this, and it will be bilingual. In English and in Korean, so you could see exactly what information the person is reading. And it's going to, oh no, it's going to,
I think there's another tab, Nancy, next to the one that you're in up at the top.
there it is. Okay, I couldn't see it because it was covered.
Yeah, that's what it does that on mine too.
Thank you.
No
So
problem.
you have to have a partner when you're doing something like this. So you can see what other languages that if you're working with anyone. I want to just kick me out, because it does that all the time. And it's very easy to get to. It's just medlineplus.gov. We're going to do a search on anxiety disorder. Anxiety. And you can see all the topics that are related to anxiety. And I do apologize because my computer is somewhat slow. It tells you what is anxiety, and it gives you places where to go for information. You can see this is for medlineplus. If you click on read more, you will get a detailed page. It will tell you what is anxiety disorders, what causes it, what are the treatments. And if you click on anything that's highlighted in blue, it will take you to another link. Here's something about this anxiety disorders that you can see that's actually written in Spanish. Diagnosis and treatment. So if you want to know what type of test they give you, if you're living with somebody who has depression and anxiety, nutrition, clinical trials, and journal articles. And if you click on a journal article, it will bring you right out to PubMed. PubMed is a publications of all sorts of articles published in the medical field.
That was a smooth transition, Nancy, because we'll be talking about PubMed next. So do you want to talk to everyone about PubMed?
I want to go directly into it because I don't know if I want to show how you can just limit your search to
I think if you
to
just click on the PubMed logo with the book over the M, yeah, that might take you to the main page that we linked to in the presentation. So whereas the other websites that we went over, which you'll notice are all .gov, so they're all run by some subset of the US government. This is yet another such resource, except this website is for research and studies. So this is less of where you would put in, I may be suffering from anxiety and I don't know if I am, or my doctor just recommended to me, you know, this treatment. I just want to know what it's about generally. You would use the websites we just went over for those types of searches. For PubMed, the results are studies. And so this is a place that you might want to search if you are interested in learning more about what studies and what research has been done on a particular condition, or to better understand the effects of a medication. Maybe if you were just diagnosed with something and your doctor prescribes you a medication, you know, as Nancy showed you previously on medlineplus, you can learn more about that medication. Here, you're going to see studies that might involve that medication. So it's definitely good that we have access to this free database, but this is more, I guess, of a complex search, because again, it's very much more in depth. It's studies. So Nancy's going to show you how to make the most of your search in PubMed and how to limit it so that the results that show up are free, full text, so you can actually read them, and then show you some other limiters, such as the year that it was published, so you can be sure you're reading the most up-to-date studies.
And I also want to say this is also for the clinician. So if you are in the medical field, this will be a good place for you to go to. A lot of the articles are from actual medical journals, so they're really for the clinician. When you're doing a search, you can either limit it. You can use the slide bar to limit it to a specific year, but I'm going to just limit it to 1 year. Select 1 year for a publication date. I'm going to select, I want free full text, because not all the articles available are full text. And you can see and you see proposed new definition of mental health. And that's it. That's one of the latest topics that are coming up. What is mental health? What's the difference between behavioral health and mental health? What is the difference between mental wellness and mental illness? So if you look, this is a free article. If you just click on it, it's in English and Polish. Click on free full text, and you will get a summary. What am I getting at now? Oh, I don't want to translate all these. Well, I just hate all these pop-ups for English. Maybe this wasn't such a good. And this is
That's
from
okay.
the
You could
psychiatrist.
see in red it says free English full text. So it looks like,
yes,
not that you have to click on it, but it looks like that link will take you to the full text.
And here's the full text of the article. Because this is my personal computer. I'm getting all these pop-ups that are like a distraction. And you can see this is the full text of the article. It's in PDF. It's exactly as if you were reading it from the magazine. From here, you can download it and send it to your email. And you can see that this is a peer-reviewed article because you can see all the references that are at the end. So we get back to medlineplus. Here, if you want to find an expert, how to find a therapist, there's the Anxiety and Depression Association of America, behavioral treatment services. If you're looking specifically for specific populations or age groups, such as children, women, older adults, here are some patient handouts. And if you notice, some of them are actually in Spanish. And if you notice too at the side, not only do you can look at different formats, you can see that there's handouts that are available as PDF, there are images, and there are videos. And if you click on the video, here's a whole video on how to cope with feelings by the American Heart Association. And it's how anxiety and other feelings can affect your mental well-being and mental health. And this is what it looks like. Sorry, my computer's slow. My computer at work is so much faster. And there's an article, and embedded in the article talks about the different types of emotions that can affect our well-being. And here are videos that you can click on.
Can you go back to medlineplus, Nancy, real quick?
Yes. And this is by the American Heart Association. As you can see, it's by the American Heart Association. It's right here at the top. Here's something about Parkinson's disease by the Parkinson's Foundation. Here's something about what is psychiatry. And you can see that not all the videos are done by the by Medline or the National Institute of Health or the Library, with the National Library of Medicine. But if they're including it, embedding it in an article, you know that it is a trustworthy information.
That's just what I wanted to highlight there. Exactly that. So should we go back to the presentation, or is there anything else you wanted to go over in medlineplus?
Specifically in Spanish, you can click on Spanish. You can go back to English. If you just want to do one more thing, mood disorders. Again, this one is available in multiple languages. So if you're working with someone who speaks another language other than English, here's in Portuguese and Bosniaski and French and Somali. So you know that some information is available for non-speakers of English. Again, here are 29 videos. There's images. And again, if you click on read more, you will get a very, very detailed. And anything that's highlighted in blue is what we call a hyperlink. So if you're specifically interested in bipolar disorder, click on bipolar disorder. And again, it will bring you right to the page about bring you to information about bipolar disorder. And that is and this comes from the Depression and Bipolar Support Alliance. Related issues are suicide. And again, let's go back to the main page. If you want to do specific schizophrenia, again, you can click on read more, you'll get the more detailed page. There's articles that talk about supplements, the drugs and supplements that are used to treat it. There's some articles and more information from the National Institute of Health. There are 2 articles in the medlineplus. There's also video as well as images, and here are more information about schizophrenia. So even though medlineplus is not dedicated specifically to mental health, you can get to the mental health information by searching on specific aspects of mental health. And if you want mental wellness, again, older adult mental health, child mental health, these are places that you can go. There's videos. If you click on mental health screening, how they screen for mental health and mental health wellness, there's a whole article about that. And the type, and also some of the disorders that they screen for. What is a mental health screening? What do I need it? What happens during a mental health screening? What are there any risks? What the results mean? Who's involved with the screening, and what is the difference between a psychiatrist and a licensed clinical social worker? So it's here to help you understand more about what is mental health, what is involved, treatments, and also sources of support, and also where to go for professional help. Another resource that I want to go into is the Elizabeth Public Library webpage. If you go to our webpage, which is elizpl.org, which I typed in, this is our home page. On the blue ribbon, you hover over resources, you will see the community resource directory. And that'll bring up our community resource directory. We have many topics such as if you're looking for resources on aging, nutritional assistance, legal services, and underneath mental health services, we have a whole list of places that you can go to. Many of them are free, some of them are on a sliding scale, but they're places that you can go to for mental health. Child's Mobile Response and Stabilization Services, some of these are part of Trinitas. Some of them deal with specific aspect of mental illness, such as Imagine. This is a center for children who are coping with the loss of a parent or grandparent or sibling of an immediate family member. And there's Bridgeway. They offer all sorts of mental health support, anywhere from day programs to counseling and the whole spectrum. So you don't have to just go to a website such as medline.gov if you're just looking for a local resource. Tap into us, tap into our website, and we're only, like as Ally said, we're only a phone call, an email, or a chat away whenever you need any sort of information. We're here to help you. Any questions?
Let me get back to our presentation. Thank you, Nancy. I'm just gonna, do you mind stopping your screen share? Sorry, that's my daughter.
That's okay.
In here for a moment. Can you stop your screen share, Nancy?
I can do that. There you go. You should be able to.
Okay, great. Okay, here we go. Sorry about that. Okay, so we talked about these three resources: mentalhealth.gov, which showed us some simple basic information; National Institute of Mental Health, which provided a little bit more in-depth about different mental health topics; and then medlineplus, which is definitely far and away our favorite, which in addition to being able to just run your searches, offered information that really ran the gamut from medications and studies and all sorts of information that Nancy went over. We looked at PubMed briefly. If anyone has any questions, I'm happy to go back to it, but in the interest of time, we'll just skip ahead. We did look at PubMed when we were looking at medlineplus, and Nancy clicked away to an article on PubMed. So we showed you how to access articles there. The most important thing to know is that not all the articles that show up in your results will be free full text. So the most important limiter you could find would be free full text. And if you need help, an email address is here on the screen. You can always email us if you want us to do the hard part and do the research for you. We're happy to do that. So a couple more resources for you. We have two here, which are websites that help you evaluate internet health information and online health information. So it's not specific to finding mental health information, but of course it's mental health is within the spectrum of health. So these will be helpful to you as you continue finding websites that you deem reliable. I'll just click on one. And the screen sharing went away. Sorry, hold on one moment. Okay. So this is actually a tutorial from medlineplus, and it goes through how to evaluate websites. So it's a free resource that you can use to better understand which websites are reliable. And one more thing that I'd like to show you is a resource guide that Nancy and I put together. It is a document that is free for anybody to use and download. I will make a link available in the chat here on Zoom, and the link is also in our slides, which can also be shared after the presentation. But basically, it's 2 pages of some resources that you can use to find mental health information. So the government resources, many of which we went over already, trusted hospitals and medical centers that offer information, support and advocacy groups, some local to New Jersey. I included a link to our community resource directory, which Nancy had already gone over, that includes some local resources as well, publications, research, and fact sheets that you can share, and then of course the links to how you can better learn how to evaluate online health information. So I hope you'll find this useful. Please, I hope you access it, download it, and share it. This is basically where we would love it if you began your search here, or if you contacted the library, and we can help you find whatever information you're looking for. So lastly, I just want to say, and again, I touched on this at the beginning, that the library prides itself on being a touch point in the community where anybody can come to get the best and most reliable resources. So we partner with a lot of organizations, nonprofit organizations that serve the many needs of those in our community. And we are definitely looking to expand that. So if you represent a mental health organization, or if you're connected to one that you think we should know about, please let us know, because if somebody, a patron, comes to the library and asks us for help, we want to make sure that we can provide them with the best organization that's local, hopefully here in Union County. We do a lot of work with the Mental Health Association of New Jersey as well. And before the pandemic, we had weekly Mental Health Mondays where they would come and visit the library for drop-in hours that anyone can come and talk to somebody from the Mental Health Association of New Jersey. So these are the sort of things we're always looking to do. And we hope that you'll see the library as a place to find this information, and contact us if you ever need any help with that. So Nancy, if nothing else to add, then we'll open it up for any questions. I will share the link to the resource guide, and hopefully we'll share the slides as well to everyone who registered. Thank you so much for having us here today and listening to our presentation. I hope you got something out of it.